Welcome everyone to this session, this training series of Nursing Care Plan. My name is Minu Perimathi and I'm one of the students doing Certificate 4 in Assessment and Training through Plenty Training. Before we move on to our introductions, let me point out a few highlighting points here. This is 91 People's Road. This facility has got toileting facilities. So if you move on to the right side of this room, there is toileting facilities. Catering is available after the training. In case of an emergency, we have 3 exit points. So the nearest exit point is right behind us here, and the assembly area will be in the backyard or in the front yard. Hopefully we don't have to use it. Basic first aid kit is available here in the top shelf if needed. Just want to highlight a few class etiquettes as well. Please turn the mobile phones off or keep it in vibration mode. If you want a toilet break, you can just stand up and go without much disruption to the class. Otherwise, during the class itself, let's try not to talk over each other or be respectful. If you have questions, please raise your hands and I'll try and we'll discuss the points as much as possible. Otherwise, so I'll just start with my own introduction. My name is Minu. I did my Bachelor of Nursing Honours degree back in India in 2008. I finished my course in 2008 and then moved to Australia, came to Australia in 2010 and did my Bachelor of Nursing post-registration course through Ballarat University, now known as Federation University, and then did a short stint in a couple of nursing homes and then moved on and started working in Gratzner House, which is a psychogeriatric aged care facility in GD Health, Shepparton, and worked there for 10 years, which I really enjoyed. And then from there, I've moved on to correctional mental health nursing now. During this time, I found my passion and interest in teaching and mentoring, which is why I'm doing this now, and I'm thoroughly enjoying this course and everything that I'm learning with it. I'm learning as I go, so bear with me. Okay, can we start with your introduction as well? We can start with you, Jisha.
Yeah, my name is Jisha, as you said, and I'm working as a financial accountant in GB Health. And I came here in Australia in 2015, and then I did the master's professional accounting, then I continued the same profession and as a manager, like a financial accountant. So that's my life is going in Australia.
What would you like to achieve through this training?
Like getting more knowledge about the nursing is the biggest industry in the Australia, so I just want to learn more about that side. I'm also working in the health sector, so it's benefit more me.
Wonderful, wonderful. Next, you Shilpa.
Hi Minu, thank you for the introduction. My name is Shilpa Thomas. I'm a registered nurse, currently working at one of the organizations in the regional Victoria as a quality coordinator. I did my Bachelor of Pharmacy in India, and I moved to Australia in 2012, and I did my Bachelor of Nursing at La Trobe University, and I've been working in aged care since then. After graduating from La Trobe, so I've been working in aged care for last 7 years as a registered nurse. I do have passion in aged care where we can look after the residents, especially the elderly people, and so I'm just here to know more about how to review an assessment and how to evaluate the care plan. So I'm hoping that I will get more information regarding the nursing care plan review by getting information from you. Looking forward.
Hopefully I can help you more in that area.
Yeah,
Thank you. Thanks, Shilpa. What about you, Anish?
Yes, my name is Anish. I work in the kitchen in a nursing home. So I work as a kitchen hand right now, but it's my great dream to become a nurse. I think it's a very valuable profession to get into. So I'm looking forward to becoming an EN in the coming years. So this is why I'm doing this course. I want to know about care plans and how it works out.
Thank you.
Very
Thanks
excited.
for coming.
Well, thank you.
What about you, Norman?
Hi, I'm Norman Karumathi. I am working in a sales with Bega Cheese, which is a dairy industry, dairy company in Australia. I've been into sales since 2008, but this time if I get more knowledge in nursing and caring, and I've been working, I've done nurse, aged care for quite some time, so I've got a bit of a background, but I thought with this course I'll get more knowledge in mental health and psychiatry.
That's good.
Yeah.
That's good. So we all have some experience in healthcare field, which is really good. One important component of nursing itself, what we see out there in a hospital or in any clinical environment where nurses are available, you see, that's a good nurse. You might have an encounter with a nurse and you think, that was really good. I actually achieved or I received what I wanted through that nurse. So what we don't look behind is that there may be a few criteria that nurse is meeting that makes her a good nurse or him a good nurse. So that's what we are trying to look into through these training sessions. I just want to show you a YouTube video. Let's have a look at that. It just basically shows what nurses are and what we are looking at when we are caring for our patients and the importance of empathy in nursing. So just going to show you this one. Might have to turn the ads off for this. this off now. We don't want to hear all the ads as well. How did you find the video?
Very touching.
It is
Very
a touching
touching, yeah.
video, isn't it?
Yeah,
It just,
very well made. It's very good.
it's a good one. It actually shows you what sort of scenarios that we can encounter when you're working in a clinical environment, right? Sometimes they may not say it. You will have to deduct it from the facial expressions, from their verbal communication or non-verbal communication, their body language. It will be hidden inside all that little nuances there. So, as nurses, we have to deduct all what they are feeling, their emotions and feelings and all. Sometimes it's not as obvious. Like some may not say that I have this issue or I am in pain. So that's one of the areas. Critical thinking comes as part of the nursing care. All right. So this is basically what we are doing in the first session. So you saw that video. I just want you to think about that and then think about an experience that you had with a good nurse. What you consider as a good nurse, and note it down in that handout that I gave you. Overview on that one there. So I'll give you 10 minutes. That's okay?
Yep. Just a few words, or you want it like sentences? Right
Just
now?
a few sentences.
Yeah.
As an experience?
Yes, an experience that you had, and why would you consider that
As a good nurse.
As a
That
good
was-
nurse, yes.
Extra sheet.
Right. How are we doing?
I'm finished.
Norvin, can you go through your experience and tell us what you felt? I'll collect the papers later. Just want to know from in your valley, what was the experience and why you considered that nurse as a good
I
nurse?
didn't mention any example as such. I just, from my point of view, like a good nurse is someone who can give a good care, like in terms of personal care, personal understanding. Of course, got a good knowledge in medical care, but I don't know, since I'm not from a 100% medical
No,
background.
that's okay.
I don't know how to explain, but to me, if
Can you point out just one experience that you had in the past, ever, with not just for you, or it can be for your family member or your friend or anyone that you saw, oh yeah, that's a good nurse, you know, like you felt from that experience that she or he is a good nurse.
an experience I had when I had just a random visit at Royal Children's Hospital just to deliver some pizzas. There's a boy came in with a fracture, I think multiple fracture. By the look-wise, she had tattooed all over the body, like wherever we see, we can see tattoos all over. Her hairdressing was like a fully casual, where we never think that she can give a good care from my point of view. But when the boy came in, she started. He was crying and it was really loud. But the way that nurse treated, so the way she treated that boy, like he's in a pain, but the way she talked to him, and his parents was already there, but the way he talked to him, I don't think she have done much things, but the first impression that the boy got from that nurse was really good. Like she was looking after him. She was actually just talking to him. They might have given some painkillers, but the way first responded was really good. It was really appreciative. From what I thought of that lady or a nurse was entirely different when she
started caring.
Giving a care to someone.
Can we all agree in this scenario that Norvin has just said, that it's not about peripheral appearances, isn't it? It's not about what we see outside, it's what's inside. Empathy is it's the first and foremost component in nursing, and it's not what we see in the nurse from outside, but how she performs and how she deals with or cares for the people. That's the main area. What about you, Anish? Can you please explain yours?
In my opinion, a good nurse is someone who has. In my opinion, a good nurse is someone who has empathy and who's good to deal with patients, who comes across as open, and someone who makes the patient feel comfortable and receptive to care. And in one experience I had is once I had a fairly deep laceration to my little finger, and I went to the hospital, and the nurse who looked after me, the way she communicated and the way she dealt with it put me at ease, and I really felt that this person really cares about what she's doing, and also I felt that she's very competent in what she was doing. She knew what she was doing, so it gave a lot of confidence for me to be a recipient of her care. So I think, in my opinion, knowledge of what a nurse should be and skill sets that's necessary, and also having the right set of attitudes, especially empathy, is key to be a great nurse.
That's good. That's good. So basically what we are trying to say here is that she may not be confident inside, but she's showing it.
Yeah.
She is coming to you as if she understands the situation, and she's there for you, regardless of what she's feeling inside, but she's showing you or telling you in her own way that I'm here for you and I'll be here to help you. Is that right?
That's
Do you
right.
agree with that?
I agree.
Thank you. Thanks, Anish, for that. What about you, Shilpa?
I have written a scenario when I had chest pain and admitted to hospital when I was 25 years. Then considering my age at that, I have written experience when I was admitted in hospital when I'm 25. I had chest pain and I was admitted to one of the hospitals. So I met with a nurse who was very compassionate because she knew what I was actually feeling at that time, especially a person who get chest pain during that young age. You know, I was very shocked and I was not sure what was actually going on in my life. And I don't know whether it was actually anxiety or actual chest pain, but she stayed with me. She explained to me what was actually going on with me. And I have experienced that she was a very compassionate and a love, and a caring nurse because she understand my care needs, and she stayed with me throughout. Even I think most of her shift, I think she stayed with me to make sure that I was comfortable. So I felt like I felt like she was not really just a nurse, she stayed like a family member too. Yeah, I felt like a very empathetic nurse.
It's okay.
Nurse make sure that my pain was well controlled with the pharmacological interventions, and she gave me medications on the top of my pain and made me felt comfortable. And when the results came back, it was not actually chest pain. It was just my anxiety. It was my exacerbation of, like a reflex. I do have some gastric issues. So she stayed with me and she explained all these scenarios with me and made me comfortable.
So from what Shilpa just explained, thank you Shilpa for your explanation. What I understood, and you can see if you agree with me here, is that she was non-judgmental. She was right from the start. She was there for you. Like she wasn't like saying that, prejudging that this would be the reason why you're having the chest pain. She was there for you right at the until the end, and even though it was good that it wasn't real cardiac related chest pain, and it was just a anxiety thing. I shouldn't say just an anxiety thing, it is a big thing too, but she was there for you. That's a good thing. Empathy, compassion, knowledge, non-judgmental attitude, those were the characteristics that you found in the nurse that you found that was really good, helpful to you in that scenario, isn't it? Yeah, that's good. Thank you. Thanks, Shilpa, for that. What about you, Jisha?
For me, my experience, basically I'm not from the health sector, but everyone should have the personal experience in their life. So for me, it's like my second delivery happened in hospital. Like for that, my happy moments, the nurse, one of the very experienced, I believe, the very old nurse, she was the in charge on that day for my cesarean and the delivery whole day, and taking care of the baby and my stress, my status on that level, controlling my situation, my family, and it was not COVID time. So no one else was there with me. So I got that very good care on that day. I really appreciate the moment she was taking care how that situation and the experience I can feel her taking care of the baby and sharing the experience how to take care of the baby and the knowledge behind that experience. So that's, well, I would say, as all you mentioned, like a nurse should have the caring, compassionate, and I would say a good listener
as well.
So that's, I would better to say in addition to that.
Yeah. No, it's a really good point that you said there, to listen to other people without having a prejudgment, isn't it?
Yeah.
Like you're not, as a nurse, everyone here will be doing your EN course now, and will get your registration as enrolled nurse soon enough. So here we just talked about some of the characteristics that a good nurse should have. Like non-judgmental attitude, dedication, being knowledgeable, and it's not just about the peripheral appearance of the person itself, what's inside you, what mind you have to care. Do you have a careful, that sort of mind attitude? What else did we talk about? Be a good listener. So those are some of the good. Those are some of the good characteristics that we usually find in a good nurse, isn't it? Okay, so this is what we cover in the first session in this training series. I will collect those papers that you have written. Thank you. And I have send you a link in your email for feedback. So if you could kindly fill that out as well.
Yeah.
Is there any questions? That
Do you want me to
you'd
do
like
the email
ask?
now? The-
You can complete it by the end at the end of the training.
Yeah,
That's
sure.
okay.
Yeah.
Is there any questions or anything that you feel like talking about in this regarding this session?
No.
No, I think we're pretty good.
Yeah.
Thank you.
Thank
And
you.
thanks for your time.
Thank you.
Thank you.